Okay, as you can see now. So the first question we have in the exam that we're going to talk about is the topic related to the hospital acquired infections. So speaking about this hospital acquired infection, I hope the screen is visible now.
Yeah, it's visible.
Okay, speaking about the hospital acquired infection is a topic of interest for the first question. And the most commonest mode of transmission of infection in the hospital ward and ICU. We have four options. One is a respiratory droplet, infected syringes, intravesical catheters, and the contact with the hospital personnel. So these are the four options which has been given on the exam yesterday. I hope the options are right. Since it is a recall questions, we may have the alternate options or maybe some other options that has been asked in the exam, but we will go for the most common ones. We will discuss the topic which was related. Okay, speaking about the first one, the respiratory droplet, which is the most common in the respiratory infection. But speaking of the hospital acquired, most common mode of respiratory infection transmission. But speaking of the hospital acquired infection, especially in the hospital ward and ICU, I don't think so. It's not the primary and most common transmission route. Okay, and next is the infected syringes. Yes, it could cause a high risk, but less frequent. Okay, so since it is a less frequent, we cannot add it in the commonest mode. And next is intravesical catheters. So most common source of UTI, but are limited to the certain patients. What about the patients who is not using a catheterization? So its usage is also limited. That ended up with the option of contact with the hospital personnel. So contact with the hospital personnel or transmission via healthcare workers is the most common route of nosocomial infection. Okay, so the commonest mode of transmission of infection in the hospital ward and ICU is direct contact with the hospital personnel or the healthcare workers. Okay, this is the first question which we got it in the exam yesterday. Let's move on to the next question. So speaking about that, the young basketball player with the height of 188 centimeter and arm span of 197 centimeter presented with the diastolic murmur in the second right intercostal space. And the cause is, so they are asking for technically the young basketball player. That means he's a tall player, so with a height of 188 and arm span of 197. So speaking about the 188 and 197, you see you get about like a 9 centimeter with the arm span exceeding the height. Yes or no? So the arm span to height ratio, if we are calculating the arm span to like a height ratio, I hope you can see the screen and hear my voice clearly. So the ratio of your arm span to the height is exceeding 1.05. So it is suggesting that the patient is having a connective tissue disorder. Okay, connective tissue disorder. It could be anything. And here they are proposing with the diastolic murmur. Speaking about that, the options narrows down as to this thing. What do we call that? The Marfan syndrome. Because in the Marfan syndrome, we experience a variety of valvular abnormalities as well. So speaking about the Marfan syndrome, what is the Marfan syndrome? Where do you see the defect? We may see the defect in the gene. What gene? Most probably in the fibrillin 1 protein defect could cause us Marfan syndrome. So speaking about the Marfan syndrome could be related to the variety of the complications. Marfan syndrome could be related to the variety of complications. And speaking about the variety of complications, the most common cardiac complication, if we discuss, we may get aortic regurgitation, mitral valve prolapse, mitral valve prolapse. MVP is the most common one. Is the most common one that you may expect to see in the Marfan syndrome. So, what are the other cardiovascular things which is associated with the Marfan syndrome? If you ask me, the other things which is associated with the Marfan syndrome is the number one MVP, number two AR, number three is thoracic aortic aneurysm. Thoracic aortic aneurysm. And number four is aortic dissection. Aortic dissection are the four common things which has been associated with the Marfan syndrome, where you may see here the height with the arm span exceeds the height, and the young patient with the diastolic murmurs. So speaking, let's come back to the murmurs. So we know that the Marfan syndrome is associated with the four things: aortic regurgitation, mitral valve prolapse, thoracic aortic aneurysm, and aortic dissection. Now coming